Hello, my name is Marissa Fernandez, and today I will be discussing why preventing child maltreatment deserves our full attention. Let's start off with imagining a child in your neighborhood. Maybe a cousin, a sibling, or a student you once knew living in fear, pain, or neglect. Obviously, you don't want them living through that, but sadly, this is a situation that is more common than we realize, and by ignoring it only allows the situation to become more normalized. Today, I want to persuade you that preventing child maltreatment by addressing the risk factors and strengthening the protective factors is not only possible, but vital for the future of younger generations. Let's start with local and national impact. Child maltreatment includes physical abuse, emotional abuse, sexual abuse, and neglect. According to the U.S. Department of Health and Human Services, more than 600,000 children in the U.S. were victims of abuse or neglect in 2021. This is the equivalent of one child every 52 seconds being neglected or abused. In New Mexico, child maltreatment rates consistently rank among the highest in the nation. The long-term effects include developing delays, mental health disorders, academic struggles, and an increased likelihood of future substance use or criminal behavior. Oops. Sorry. Now let's discuss the risk and protective factors. Research shows that we can prevent child use by addressing factors and reinforcing protective factors. Let's dive deeper into the risk factors. The risk factors include poverty, caregiver substance use, domestic violence, and lack of social support. All of this means if you are struggling financially, you should consider not having children until you're ready or financially stable. Take extra precautions like birth control, or even think of what would be better for your child, like foster care, for instance. Also, make sure that your babysitters are appropriate for your little ones and don't expose them to things that are out of their age level. And you want to be able to trust your sitters are taking care of your children as if it's their own child. You would never want to be blindsided by an abusive babysitter. You also want to ensure that your caregiver is properly caring for your child and not just putting on a show while you're around. A good indicator of this would be observing your child's behavior, and if you notice a decrease in their activity level with playing, or if you notice that their behavior has gone off the charts, just being aware of that. Now let's discuss some protective factors. Protective factors include parental resilience, access to healthcare, community support networks, and early childhood education. Dr. Deborah Darrow, a child welfare researcher, emphasizes prevention begins by supporting families before harm occurs. An example that I have witnessed would be my mom being able to get insurance for our entire family, which allowed us to take my little sister in to go see the doctor at a cheaper price because she had an ear infection, and due to us having the insurance, it helped us only pay probably like $5-10 for her antibiotic, whereas if we didn't have the insurance, then it would have costed us thousands of dollars that we would have had to pay out of our own pockets. Another example would be nurse-family partnership, where trained nurses visit first-time low-income mothers to offer guidance and support. According to a study in 2014, my apologies. The program This program reduced child abuse and neglect by up to 48%. Now, let's discuss the importance of taking action at all levels. We must take action because it can help better our communities and lead to better environments. For example, some things that we could change at different levels would be New Mexico investing in family resource centers, mental health support centers, and parenting educations locally. Regionally, we can collaborate among schools, hospitals, and community organizations to track and support families who are more at risk. Nationally, while Family First Prevention Services Act was a major step forward, it also needs sustained and increased funding to be even more effective than it is already. Now, lastly, globally, the World Health Organization labels child maltreatment as a public health crisis, which urges all nations to implement community based interventions. Now, to conclude my speech, child maltreatment is preventable, but only if we are willing to take the action and work together. We must support proven programs, educate our peers, and advocate for better policies. And each of us has a role in increasing a safer, more supportive world for the younger children of our generation. And lastly, no child should grow up in fear, and every child deserves to have the chance to thrive. Thank you.